now. So if you don't want to have your face on the recording at all, then please just switch your camera off. So I will start by handing over to Marnie O'Lock from Eastern Volunteers. And Marnie, I'll stop sharing my screen so Marnie can share hers. And over to you, Marnie. Thank you so much. Marnie, I think you're still on mute, Marnie.
I think we'd have this down pat by now. Thank you for the acknowledgement to country, and I'd also like to acknowledge the traditional custodians of the lands that we meet on today. Just going to share my screen with you. And lovely. So just touching base with our journey so far with mandatory vaccination. We currently have 52 active staff and volunteers, and we have 48 that are double vaccinated. We've got 10 inactive volunteers, and when I say inactive, that might have been because we've made them inactive, or they're currently taking a break somewhere. We have a few stuck in Queensland at the moment, and our current operation, we're working a mixture of both remote and in the office.
Marnie, do you want me to share your screen for you?
Oh, I thought I had.
I can't see it, so I don't think it's there.
Is that there now?
Yes, there now. Thank you.
Okay, beautiful. All right. So some of the changes when we had the announcement, the changes came literally as we were about to start interviewing new candidates, which was an interesting position to start in straight away. So we've had to have a look at our recruitment straight away and add some changes into some of our questionings in recruitment and raising the issue of vaccination both now and into the future, not knowing what's going potentially to be ahead with boosters and other mandatory implications. We've had to go through and change our position descriptions and our contracts as well, adding clauses into for vaccination into the future and any other public health order that comes into play. We've grappled a little bit with record keeping, what information we are going to accept and how do we actually store that, because it's a medical record. It kind of takes us into health record storage, which is a little bit more complicated than the current storage that we follow at the moment. So we still haven't come to a solution on that as to how and where we hold the information. At the moment, we are grabbing the information and we're sorting through that one. Obviously, for our audits, we've got a basic spreadsheet that we're keeping with dates and of both vaccinations to be able to evidence if we need. The biggest thing, apart from having conversations with people and understanding who is vaccinated, and we started some of those conversations early, is our duty of care to our people has been our biggest point that we're still walking through. And I'm hoping today collectively we can help each other with that. Is how do we protect our workforce and our clients, because we're finding, in the roads, our clients are asking drivers if they're vaccinated. There's a lot of conversations that are very different now, and the transaction between families ringing us to find out what the status of our staff is, and being concerned for their families' welfares. So we looked at duty of care and thought we've got our standard PPE and our COVID cleaning and social distancing and separating areas and doing all the things that we can do. But the first thing that we were thinking around was, well, do we transport unvaccinated clients? And we haven't come to a landing on that. We have come to, I suppose, we're starting to work towards when there's low transmission. Do we transport them but differently? Do we transport them in a bus so that we can get more distance to protect the driver? Because our concern is we have vaccinated drivers. If we put unvaccinated people with them, are they more of a risk to our driver? That's one position and the reverse. So we're looking at a couple of models. One is, yes, in low community transmission, do we continue to transport but a little bit differently? Do they have a higher PPE requirement, and how will that be accepted? Or do we make a decision not to transport unvaccinated people at all? So that's one of the things we're still grappling with. Do we, at the point of intake, we're preparing to ask people for their vaccination status, and again, what proof do we need, and the admin load on obtaining that information to know that that it's valid what we're getting, and to be able to do the system changes, to be able to report on that, and to be able to have a look at when people are due for their annual vaccinations, their annual booster shot, and how do we manage that process as well. So for us, we've already asked our provider Outmatch to make some changes in preparation that we may head down that path. But it's certainly something from a process and system point of view that could be quite admin heavy. We're also doing some preparation and managing for workforce communications. You know, if we do go for periods of not taking vaccinated people, how do we manage those difficult conversations with clients, and how do we get the staff on board to do that? And you know, how do we do that in a supportive way to help encourage vaccination as well? What do we do with people that have a medical exemption? Are they different to people that are just choosing not to vaccinate? So it's quite a minefield in there for us at the moment. We haven't got a landing. We're communicating in our newsletters our driver statuses at this point. We're noticing coming through on contracts prior to the mandate as well that home care package providers were adding to their contracts that all our workers are to be vaccinated as well. But my main question, as I think from a VTCTA perspective, is there a point, and at what point with the current increase in numbers is it too dangerous to operate? Knowing that, you know, this where we are at the moment is quite significant, and it's going to go up. Our contracts say that we can't close for CHSP, but is there a point of responsibility? Where does it lie? Is it with the organisation? Is it with the department? But at what point do we need to close our doors if this gets quite large, or do we continue to operate? So I'd be really keen to hear people's perspective on that. So we're constantly moving with what we're doing, and we're constantly coming up against things, as Rita was talking about before. You deal with something and something else pops up that we haven't really thought about, or, you know, someone raises an objective to things. So we've had quite a few conversations, and I'd be keen to hear where everyone else is at today.
Thanks so much, Marnie. So if we've got questions, we might hold them to the end, if that's okay. Yeah, is that okay, Marnie?
Yeah, it's fine.
Great. Would you like to stop sharing your screen, please?
Yeah, I've just got to find a
button.
There it is.
Great.
Done.
Thank you so much. Jadie Hunter from Red Cross Victoria is the next person to speak, and I will hand over to you, Jadie.
Hi everyone. I too would like to acknowledge the traditional custodians of the land we meet on today. So I'm on the lands of the Wurundjeri people of the Kulin Nation. Pay my respects to elders past, present and emerging. Thank you everyone. Marnie, hopefully I might be able to answer what Red Cross is doing in the space of, in terms of closures in with what I'm talking about, because we're all in that space at the moment. So Red Cross patient transport volunteers were eligible from 17th of May to receive the first vaccination dose, because we fell into the category of 1B. So our drivers have been vaccinated, but we didn't mandate it until, of course, the state government announced it earlier in 1st of October. So like everybody else, we are wrapping our heads around capturing all of the data. Where do we store it, and where do we store it on a legal perspective? So we're focusing on those processes. We also have about 330 volunteers across the Victoria of capturing their vaccination status. So what we've currently put in place is we've got a couple of volunteer teams meetings happening this week to communicate to all of our volunteers. My team are then going to be following up with each individual volunteer who have not attended the meeting, so that we can talk to them one-on-one. Plus, we're also sending out a survey just to get their vaccination status and sort of uploading that and then requesting their certificate. Some of our things that we have in place already to help capture some of this information is We do pre-COVID screen calls with both volunteer and client before entering the car. So the day before, we ask them, have they got any symptoms? Are they waiting COVID results? All of that sort of thing. And at each point, we've got a process map that will cancel the drive if needed, if someone is feeling unwell. The other thing that we've got in place, which is a bit of a fallback plan, is that we have QR codes in all of our vehicles. So when it was mandatory that we all had to scan into every venue we visit, we also put all of those QR codes in our vehicles. So we get both clients and volunteer to scan in. Because of the volume of volunteers that we have to capture, we are prioritising volunteers who are driving in the first 2 weeks to make sure that we've got their data, their vaccine status, before we even get them on the road. And then we're madly going to catch up over the next 2 weeks in that time. It's been decided that the difficult conversations with volunteers, that for those who are, whether they be anti-vaccinated, medically exempt, the conversations are going to filter up to myself as well as my manager, the state manager of community programs. And those conversations are going to sit with us rather than my team of program officers. We are still working on where we stand with clients, because the program for us is we pick up the gaps. And because of our ethos of Red Cross, of neutrality and impartiality, we are grappling with where do we sit in terms of clients being unvaccinated. We support vulnerable community groups. So we haven't quite landed in that space and what it means for clients yet. In terms of what Marnie's raised, when local government areas go into shutdown, we actually automatically suspend the service in that area. So recently when Traralgon, the LGA, the Latrobe Valley went into lockdown, we suspended that service because to us that means there's high volumes of community transmission. We want to protect both our volunteer and clients. So that's how we operate in that space. So our metropolitan service of late has been suspended since the 1st of September. And we're just waiting for when restrictions ease so that we can start that service back up. And then, so at the moment, our regional services are still operating. Our services based in Mansfield, Wangaratta and Wodonga, we're going to have to ensure that all of those volunteers are vaccinated because they're crossing into Albury, which is still that border. And Mansfield in particular is outside the border bubble. So we are making sure that they're all vaccinated as well. So there's a couple of shifting goalposts that we're constantly monitoring in this space. But for us at the moment is just ensuring that the drivers in the next 2 weeks who are driving have at least had their first dose. And from what I've heard from a lot of our drivers, most of them are coming back to say they're unvaccinated. Or they're not unvaccinated, they are double vaccinated, I should say, but we just haven't got our systems ready to capture that information yet. As a national organisation, our national areas are still trying to work out the Red Cross stance on mandatory vaccine for all staff and volunteers. So we're in the unique position where Victoria as a state is ahead of the organisation. So we're waiting for the organisation to catch up with our system processes where we store all that data and everything else. So hopefully I've answered some of questions. For everyone.
Thanks so much, Jadie. That's really, really helpful. And I'm sure there's some questions there, but we will hold those to the end. And I'll hand over to Rita from Bridges. And Rita has a presentation. Are you okay to share that, Rita?
I think I can manage it. Hang on. Can you see that?
We sure can. If you can make it slide view so it's a bit bigger, that'd be fantastic.
Yep. In the beginning. Beautiful. Okay, well, thanks, Suzanne. Thanks for asking me. And I'd like to also acknowledge the traditional landowners on which we meet, and Bridges meets on the Wurundjeri and the Bunurong people of the Kulin Nations, and pay my respect to their elders past, present and emerging. Okay, so COVID vaccine policies. We've been talking about this for a very long time. Basically, we thought about this last year, and like everybody else, there were so many facets to it. There were so many legal ramifications. We had to protect our employees, our staff, our volunteers. It was a decision that we hoped would be a personal choice for everyone. But we talked about it at board level, and then basically we didn't come up with any ideas other than the ones we were doing. And at the time, like everybody else, we're waiting for someone else to make that choice and show us what they're doing. We looked at in October 2020, a precedent had been set in court when a home care worker refused to be vaccinated, and that was just a basic flu vaccination. The Fair Work Commission said the dismissal wasn't unjust, it wasn't disproportionate. She refused a free and mandatory vaccination. So we were sort of looking at that as well, wondering, could we mandate a policy for Bridges staff and volunteers? We just still weren't sure. In February, we put out a survey to our staff. Now we have 15 staff and we had a 75% participation rate. We asked them one question: when the COVID vaccine is available to you, and there were 4 choices: I'll get a vaccine, I don't wish to get a vaccine, I can't get a vaccine, or I'm unsure and undecided. So you can see from that 50% of staff said they were going to get it, 40% said they were unsure, and 10% said they didn't wish to. Nobody said they couldn't get it. So from that, we sort of looked from a board level and we decided, yep, people needed time, they needed education around getting it, and they needed a reason why they needed to get it. So again, we didn't make any snap decisions, and basically we kept looking at what was out there. And so in July 21, the government asked us all, and you're all in the same boat, to record our vaccinations, excuse me, total volunteers and staff, their first dose, their second dose through My Aged Care. And I run a CEO chatter, and basically I use that emails that I sent out to volunteers and staff, and I indirectly asked them, because at that stage it wasn't mandatory, so I made it very careful in how I worded that document. And I basically told them that it was a requirement that we were reporting now from government. It was just a voluntary reporting. I reiterated to them that we had a commitment to their privacy, but if they wished to disclose the information to me, that they could email me. And so back in July, I was getting emails from volunteers telling me they'd had 1 dose, they'd had 2 doses, and they were sending me their certificates. And at this stage, no, I didn't feel there was any pushback going on from our volunteers. And basically it became mandatory on October the 5th this year. I don't know which way I'm going half the time here, sorry. So on August the 5th, we watched Bridges from a board level, how SPC brought in mandatory COVID vaccinations, and they did this for 450 staff and volunteers, staff and visitors, and it wasn't a health order directive, but it was rather a decision that they made out of their OH&S obligations, and they were deemed an essential service as well. So Bridges, went back, we had a look at our OH&S, we had to make sure it was reasonable, safe environment for our staff. And staff also under Section 25 have an obligation to create a safe environment for their workers that they're working within. So we were looking at both of these. I went to legal webinars to determine how do you develop a policy around mandatory vaccinations. And again, the legal teams were telling us it's not discrimination, that vaccination status is not a protected attribute under the Equal Opportunity Act, but they still told you to be careful on how you developed it, but they didn't actually tell you how to develop it. So, there was a lot of confusion around how do we do this? And we're not legal people, so we don't know. We kept looking at the precedents that were set in court, around the flu vaccinations, and they were around a lot of the states. There was a good one that came out in April this year, Barber versus Good Start Early Learning, and this was around a childcare and a staff member who refused to be vaccinated. And out of this, and this was in Queensland, the Commission found that it was lawful, it was reasonable direction, and it wasn't an unfair dismissal. And the points that they bring up are exactly the points that we were looking at. You know, we have an obligation of health and safety to our older people, to our volunteers, to our staff. We don't want to spread the virus. We are a highly regulated industry, as the child industry is, and governments were recommending we have these vaccinations, and the vaccinations were free, and we have policies. Well, at that stage, we don't have policies in place. So, you know, we were looking at the legal, what was out there, what we do, and we came up with really not a lot. In August 21, obviously, the Victorian Health Order will put in place for the mandated vaccination directions, of which there's 4 industries. It started off as the residential care facilities, then it involved the construction industry, and we know what happened with them. They were all angry. The education facility or education department, they're all now involved with their workers being mandated, and the healthcare facilities. Today, I think in court, there's a casual teacher who's taking the state of Victoria over unfair dismissal, and it's really around the human rights and discriminating. And the lawyers were quite clear in saying that the vaccination status is not a discrimination. So it'll be interesting to see how that pans out in court today. We all know on the 1st of October in came the health directives that we're mandating vaccinations for authorised workers. First one to be done by the 15th of October and a second one to be done by the 26th. And now I've put links in here. You're quite welcome to this afterwards if you want to look up anything of what I've said. On that Friday when that actually happened, we knew that it was about volunteers and staff, because basically in order for us to work under the essential employees, we have stayed at home under the state of at-home order. It states in Section 8 that an authorised worker is a paid and unpaid worker. So we knew when they brought this out on Friday that that involved our volunteers, and there was no way out of it because we were operating with volunteers. So it would not be appropriate to say, well, now they don't need to be vaccinated. Authorised workers, if we go to the next link at the bottom of this page, it tells us what evidence needs to be basically shown, and that's any evidence from the immunisation register, the Australian Immunisation Register. So that can involve a doctor's certificate, it can involve a certificate, the vaccination certificate, or it can be the immunisation history. And I know some of my volunteers have actually given me that instead of a certificate. So Friday, we drafted a letter, Monday, after the directive, I drafted a letter, sought board approval, and we sent it out to volunteers and staff. In that communique, I was very careful in thanking them for their time, their patience, their empathy, being flexible through this time. I reinforced the fact that we respected their privacy. I informed them of the directive, and I included the Premier's statement to back it up. I asked volunteers who had chosen not to be vaccinated or who hold a medical exemption to ring me so that we can offer volunteer roles during this time. And we asked volunteers and staff to provide proof of vaccination to me personally by email or phone to demonstrate to them that we take their privacy really seriously. So we sent out 262 staff and volunteers. Obviously not all of them were working, but at that stage, we weren't going to start putting some out and not out to others. We just did it as a collective, it was easier. 6 days later, I've received 70 certificates. I've had 2 phone calls from drivers who are not getting vaccinated, and I've offered volunteer work for them. They wish to remain engaged with us during this time. They haven't taken up those volunteer roles because they're really working from home, but they're happy to stay, and they realise they can't attend any office, they can't attend the office or volunteer functions, and they basically want to see if there's any changes taking place. And I think we discussed that with Marnie just before. People want to see if there's going to be any changes, which we're not sure about. Last week, 100% of staff had their first dose, which is great considering our survey. And I've got one staff who's just waiting for a second dose. We have an unknown status of 53% of volunteers because we were informally collecting this information up until last week. Our first dose rate is 46.5%, and our second fully dosed rate is 43.6%. And that's, I can see, increasing as we collect this information. Victoria's status as of the 10th was 85.5 for the first dose and 58.6 for the second. So I'm pretty sure we'll be going up quite quickly in the next couple of weeks. So the storage of information, all of our staff and volunteer staff have electronic files, and we're saving our COVID vaccine certificates to each person's file. And they know this because we tell them this. We updated trips. So for anyone who has trips with, you can go into crew, and from within the crew, you can enter under training. I've entered COVID vaccine for their first, COVID both for their second, and COVID certificates for their third. And then we extract crew information from the database, and basically that information is sitting in a spreadsheet that we can then refine into what programs they run, because some of it, with the reporting for the CHSP space, we're only reporting volunteers and staff who have direct client contact. So we've been able to have that spreadsheet with what programs they're in and their what certificates and what information they've given us. Staff and volunteers have authorised access levels in our systems for privacy reasons. So we believe we're storing their information as we should be. Changes to policies. Our policies we've included in our epidemic and pandemic policy, a paragraph relating to the bridges will follow government health order directives in regard to the COVID vaccinations. In our admin policies, as Marnie had said, we've updated information regarding to HR recruitment, and under volunteer policy, we've changed our recruitment as well, put in that paragraph. We've updated volunteer and staff electronic checklists to include COVID vaccine certificates when we're onboarding staff and volunteers. Our introduction to volunteering training presentations, we've inserted a page on volunteer vaccinations and why we're collecting that information. Disposals of records, Marnie's already tapped into that. And now we have to collect medical records for our volunteers. We fall into the Health Records Act, which requires us to hold their records for 7 years. So now we've had to change that information as well. We were only holding volunteer records for a year, ringing them, letting them know we were destroying them. If they wanted to rejoin us, they'd have to go through all that paperwork again. Moving forward, Senator Colbeck stated at a webinar on Friday that they're working on mandating COVID vaccines for the home care industry. So we're already doing this now. So when we come out, we're hoping that the home care industry will be vaccinated, mandated. Our roadmap indicates for us at Bridges that 80% fully vaccinated is around the 5th of November, might be as early as the 1st, and people will need to show evidence of vaccinations in the community. We run a digital literacy program supporting clients with their chosen technology, and we're teaching them how to use MyGov accounts, linking them into it so that they can get their COVID vaccine certificates. They can also ring Medicare. All our clients can ring Medicare and get that certificate printed out to them. And there's also a program, I was at a meeting where they called a ProVat in regard to you can register as a government third party and release information from Medicare with the client's permission. I'm not sure who is eligible for that, but that was interesting to listen to people telling us. A client's vaccination, we've touched on this one. When they come out, they're going to have need to have a vaccination certificate to prove that they can come out into community. Our social support groups are held in council buildings, and their requirement is in the roadmap that they will have to be fully vaccinated. So for us, we will be starting to collect that information from clients as well, without upsetting too many people, hopefully, because in order for them to come out, and in order for them to transport, whether they're going to a medical appointment, they're going to an allied health appointment, they're going to a hospital, they're going to need a vaccine certificate to prove where they're going at the other end. So I don't think it's going to be too traumatic for us in the sense of clients needing a vaccination certificate other than how they're going to get it. Under the tour guide's roadmap of COVID, we've seen that they can return transporting fully vaccinated passengers. And I've taken on a lot of guidance from this sector from previous roadmaps So we will be asking clients to show evidence of vaccinations. We send out a letter at the end of the month, which will include informing clients about vaccinations and being able to support them during this time. For Bridges clients and volunteers who aren't vaccinated, we'll find another way to connect them and keep participating in our community. And that might just be, we'll have to find volunteer drivers who are happy to take them, but at the other end, they're going to still need a vaccination to get wherever they're going. But our commitment is to keep our volunteers, our clients and our staff safe and connected. We don't want to exclude anyone. We have a board meeting in October, and no doubt we'll be talking about client vaccination policies. That's my contact details, my email. If you'd like to make contact, I'm happy to talk about anything. This isn't what you should do. This is really about what we've done and what we've done to make sure that we're following the right process. So thanks, Suzanne.
Thanks so much, Rita. It was so comprehensive, and I think it was extremely valuable. I'm sure I could see lots of people taking notes on things they may not have considered, or things they might learn from you. And yeah, we will share people's presentations as well following the session today. So if you missed anything, that will come out to you. So thanks so much, Rita. I'm going to hand over to Richard Garlick from Sunassist up in Mildura. Over to you, Richard.
Thank you, Suzanne, and thank you for asking along. And thank you for those who have already presented, and they were very comprehensive. And I'm not so organised to have a presentation and PowerPoint for you all, but I wanted to present a bit of a different perspective, because what we've done is, well, prior to that, I will say that pretty much all of our staff are vaccinated. There's one staff member who is against the vaccination, so she won't be working with us after Friday. We have a number of volunteers who have also chosen not to vaccinate. And I actually have a couple of things that I'd like to share with you, because I wanted their feedback around the reasons why they chose not to vaccinate. So just the first response from one of the, I've got the response from a couple of quite well-educated volunteers involved with our organisation. So for most, this is the response from one of those volunteers. So for most of the past 3 years, I've been regularly volunteering with Sunassist, and I have enjoyed the community involvement and serving those who would otherwise be isolated and restricted in their participation in the wider world. It was my choice to volunteer with this organisation, and the time I've given to date has been willingly. Now it feels like my voluntary participation is being lumbered with unnecessary and invasive requests for information, as well as pressure to make choices that may compromise my own well-being. I recognise the duress that Sunassist and many businesses may be under to provide a safe environment for all of its employees and volunteers in the current environment. However, the data to date is inconclusive at best regarding the success or otherwise of preventing or reducing the acquisition or transmission of COVID-19 through vaccination. Therefore, the value of disclosing vaccination status for that purpose is questionable. He does go on into other things, but he does also say it's not a decision I want to be making, or one that I make lightly. If there are other options to address the safety concerns that the disclosure of vaccination status is attempting to address, I'll be willing to consider them. He also put some things together, some details, which I'll just share a couple of those things. So mandatory vaccination creates false distinctions between people based on whether they complied with a directive, rather than encouraging people to make the best choice for their own bodies. Mandatory vaccination assumes that people cannot take care of their own health or manage health risks appropriately. He talks about a number of things. I see mandatory vaccination as eroding community spirit and a sense of belonging to something greater, both of which are attractive aspects of volunteering, and discouraging people from willing contribution to those who are disadvantaged for fear of infecting others or being infected. So I suppose, we've talked about what we do as organisations, but I think it was very important to get some feedback from volunteers around why they chose not to vaccinate, and obviously we won't be using those volunteers after Friday the 15th. We also have another long-standing volunteer who's her response when I asked her around her thoughts around the vaccination was, I'm responding as a wife of a client, a volunteer and general supporter of Sunassist. I'm very much in favour of mandatory vaccination against the virus, given that there is a proportion of the population who are resistant at present for various reasons. As vital community service, Sunassist has a duty of care to its clients, volunteers and staff to minimise risk of COVID spread. With transport in particular, in an enclosed space, in a vehicle, the risks of spread are real, including in the New South Wales transport for students, which we provide a number of community transport aspects. So our day-to-day transport, so we've got 18 vehicles. We also do assisted school travel for young people to get from New South Wales, so young people with disabilities, to get from New South Wales across the border to the Mildura Specialist School. And we also do travel for, which is 24/7 for people to get home from hospital. So we've had, I suppose, different funding bodies and different requests from those funding bodies around our status and what we're doing. This person also put that Sunassist has a social, financial and professional motivation to be part of the pathway for our community and a return to something more normal. It can be seen as a risk assessment. So she went on and made some really great points, which as an organisation, we're doing everything is expected of us. And it's quite prevalent at the moment because we've been almost COVID-free for many months, but in recent times, you may have seen on the news that COVID is certainly with us thick and fast at the moment, particularly through the Indigenous community, where some people attended a function and in New South Wales. So it really is a difficult one for us all as organisations, but of course we are required to follow what's expected and get everybody the mandatory vaccination status. So so I really just wanted to share a different perspective around what we're doing up here in a very isolated area, but it's really important for us all as organisations to make sure that we're doing what we need to firstly protect our staff and clients, but also our volunteers, who the majority of us, most of our service are run by volunteers. So we need to respect their opinions and their thoughts, whilst making sure that we protect both our staff, clients, and our volunteers. So I just thought I'd just come from a different perspective. I could give you stats and all the other stuff, but Marnie and Jadie and Rita have done that. But I just thought I'd give you a different perspective as far as coming from a couple of the volunteers that have provided feedback to us.
Thanks so much, Richard. Oh, sorry, didn't mean to cut you off there.
That's okay. That was mainly what I just want to come from a different perspective.
Yeah, absolutely. It's great to hear the different perspectives. My question is, I guess I'm interested to understand the volunteers who, or the volunteer who won't continue. There's no opportunities for them to. Were they prepared to do other types of volunteer roles, or they? And maybe I don't need to get into it, but I'm just really curious. Yeah.
He was mainly interested in the driving
okay.
aspect. So it's a bit limited, I suppose, in what they can do if they're not vaccinated.
For sure.
But in saying that, our organisation provides quite a few other services as far as Meals on Wheels, the assisted shopping. We actually have a really good partnership that we started when COVID started last year, that we're actually delivering medications for a local pharmacy. So with that partnership, they are offering information and advice around the vaccination. They actually administer the vaccinations themselves. So that partnership's been really helpful for anyone who's got any questions around the vaccination. Yeah, so that was about it. That was really what I want to talk to.
Yeah, thank you so much. I think we have about 15 minutes left, so curious if people have specific questions that they'd like to ask that haven't already been answered. We had a number of questions come through before today, but I think they have probably already been responded to. If anyone would like to ask any questions, you can write them in the chat or just unmute yourself and we can you can ask them directly. While you're having to think about that, I think one of the key purposes today is to understand if there's any key advocacy positions that we can pursue. From the discussion that I've heard today, I think the key issues are around understanding how we store the data. That's one of the questions we don't have, or we don't all have answers to. Also around, so suggestion around money to seek legal advice is one of the things that have been suggested. But I'm not hearing, and the other question I had was a suggestion, the conversations I've had over the last couple of days about funding to replace any volunteer workforce. But from what I am hearing, it doesn't sound to me like people who've spoken and the people I've spoken with, it doesn't seem to me that you are overly concerned that you're going to lose a huge amount of your volunteer resources. Is that so? Could you please let me know if you think if I've got the right take on that, or if you think differently, please jump in and I can see a few nods. So I'll hand over, I think, Marnie and Jadie.
Suzanne, I just, leading up to before vaccination, I think for Eastern Volunteers is where we took our hit going through COVID of drivers. I've lost over 45 drivers who, because they're in the same cohort, vulnerable cohort, have decided through different aspects of their lives or personal choice that it's too risky and have moved to a volunteer status. We applied for a grant and was successful because the availability of volunteers was very difficult to run the service. And that's our very next concern when we open up, as the roadmap opens up, is we're going to be restricted in service delivery for drivers. But we got a grant to have paid drivers temporarily, 5 paid drivers for 6 months. So I believe that scheme is possibly still open, and there's grants floating around for additional COVID rescues, I suppose. So that's certainly something worth, for those that are struggling, worth having a look at.
Thanks, Marnie, and I might get that information from you as well and share that after this, unless you've got it handy and you want to throw it in the chat, but it would be great to provide that later. Jadie, did you want to respond also?
Yeah, because last year when COVID first hit, we stood down all of our drivers over the age of 65, and that's when we lost a large portion of our volunteer workforce. So because we've stood down a number of services, because when an LGA goes into lockdown, our volunteers are suspended. So from what I'm hearing when I've communicated with volunteers is they're itching to get back on the road. A lot of them are emailing me already to say they're double vaxxed. Can they start when we're still waiting, especially in our metropolitan area, that we're still waiting for restrictions to ease. So I'm hearing a lot of my drivers are rearing to go and itching because they just want to get back on the road. I might have maybe 4 volunteers out of 330 that are hesitant on the vaccination process. And it's just about finding, can they potentially volunteer in other areas of the organisation, but we're not even sure if that's even feasible, given that the whole organisation is deemed to be essential. So we're just sort of working through that space. But I think out of 330 to have 4 is a pretty good ratio, and we're okay with that. So we're not too concerned about it.
So now might be a nice, appropriate time just to mention we have received some funding to run a statewide volunteer driver recruitment campaign for Victoria, and we have a session to talk about that next week. I have put the link in the chat and it'll come out in the newsletter again later today or tomorrow. So really keen for people to participate in that because, yeah, obviously there has been a big impact of volunteer resourcing through COVID, but from what I'm hearing here, the vaccine mandate is not having a significant impact for yourselves or for the sector. If anyone feels differently about that or experiencing that differently, please give me a call or send me an email, or if you'd like to jump in now. I think, is there any other questions at all? We haven't heard from a local government at all. I wondered if there's anyone on this chat who might be prepared to put in another perspective, or if anyone on the session wants to put in their perspective or experience, that'll be really valuable. We still have 10 minutes and we can certainly finish early, but while we're all here, it'd be great. I know Kevin, you're often happy to, Kevin from Knox, you're often happy to chip in if you would like to at all, please do.
Hi, Suzanne.
Hi, Kevin.
Thanks everybody for such a comprehensive coverage. I'm certainly a lot more informed now than what I was an hour ago. We community transport, that is, we don't have any volunteer drivers. We have they're all paid drivers in one way or another. We do have Meals on Wheels, and Mary has joined us today. I was wondering if Mary might have a perspective on it, because I know she has had some issues with volunteers. So can I leave it with you, Mary?
Yeah, that's fine. So yeah, for I'm sorry, I'm just trying to multitask and put all these thank you packs together for our volunteers, which is quite nice. So yeah, thank you everyone for all your input. It is a very interesting topic. So in terms of our Meals on Wheels volunteers, we stood them down last year and we've had them back with us since January this year. And obviously we did the same thing through My Aged Care, asking the voluntary disclosure whether they're vaccinated or not. We only had about 50% or 60% let us know that information. And then obviously on Friday and this week we've sent out communication around the mandatory vaccinations and the dates and things. I've had a pretty steady flow of certificates and things coming through my inbox. We'll be housing the information. Well, it's going through, we have like a special Knox vaccination email where all this information is going to. But we can also house vaccination dates on our database that we use for our volunteers. So it's easy to run a report to see who's vaccinated, who's got first dose, second dose, or fully vaccinated. But the certificates and that side of it's being housed by our HR department. Yeah, I haven't been made aware of anyone as of yet that's not willing to get vaccinated. We did ask them in the communication to let us know if they're fully vaccinated, have had a first or second dose, are medically exempt, or if they're unwilling. I haven't had anyone unwilling as yet, but yeah, it'll be an interesting moving forward, listening to what everyone's saying about updating policies and position descriptions and all the stuff that leads on from this one thing. So yeah, that's sort of where we're at the moment.
Thanks so much, Mary and Kevin. I think unless anyone else has any specific questions or would like to make any further comments, we can probably round it up for today. So last year we did a COVID-19 document bank where organisations contributed communications and policies that we could then share with everyone, so people didn't have to continually reinvent the wheel. I have a number of organisations who are willing to share their documentation, so we will send those out today as well. And if you do have any policies, procedures, or communication material that you're happy to share with us to contribute to that, it'd be really valuable if you're happy to send it through to me or give me a call, and we can discuss those. Yeah, the more that we can share that information, the more time we will, really valuable time we will save, because obviously the changes that are in place are taking up a lot more of your time and resources than we anticipated. So anything we can do to support the sector and the members through this time, any ideas at all, please give me a call or send me an email. I really value the 4 people who spent time preparing for today and presented. It's just so valuable to us. Thank you so much. I think that is all that I need to cover off for today. Yes, I think that is all. Thank you so much, everyone. Have a wonderful day. Please feel free to give me a call if there's anything else that you didn't want to share with everyone, but could have a chat with me directly about that. It'd be wonderful. I hope you all have a really great day. Thank you. See you.